Hi, my name is Katelyn Adamson, and this is my health assessment halfway video. First thing I'm going to do is identify my patient with two patient identifiers. So I'll ask her for her initials and date of birth.
KB 101489.
After obtaining a set of baseline vitals, I'm going to do hand hygiene and provide my patient with privacy. I'm going to ask my patient why she's here today for this visit.
A general physical.
Okay. Are you in any pain today?
Nope.
Do you have any concerns related to this visit today?
Not that I'm aware of.
Okay. Well, first thing I'm going to have you do is I'm going to have you stand for me, and I'm going to test her mobility and her gait. Do you have any issues with balance?
Nope.
Okay. Go ahead and stand and face this way, and I want you to put your arms straight out, turn them over, and flex up and down, and then do your wrists for me. Okay, go ahead and sit back down on this bed. Okay, and I want you to move your ankles back and forth. Okay, go ahead and relax those and bring one knee up. And then go ahead and relax, and then the other knee up for me. Okay, I'm also going to be noting my patient's hygiene, whether she's clean, if her clothing is appropriate for the weather, and she is well groomed. And I'm also going to be assessing her skin color throughout this and just making sure she's not pale or jaundiced or anything of that nature. I'm also going to take a look at her hands, and I'm going to be inspecting her nails and looking for any kind of clubbing or brittle nails. And her nails look good. They're not brittle, and there's no clubbing to them, which could indicate a respiratory issue. I'm also going to be noting her posture. She has a good posture. She's not slumped over. And I'm also going to be noting the whole time her affect and her mood, and she's pleasant and cooperative. No signs of anxiety at this time. I'm also going to ask her during this assessment about her nutritional intake. What was your last meal?
Breakfast this morning. I had a bowl of oatmeal.
And how much of that oatmeal did you consume?
All of it.
Okay, do you feel like you have a good appetite, or do you feel like you don't have a very good appetite, or have you been nauseous?
Yes, I eat all the time.
Okay, that's good. I'm also going to note whether she's making eye contact with me or whether she's looking at the floor during the interview, and I will also be noting her level of consciousness. She is alert and awake. She's not lethargic at all, and she is oriented ×4, person, place, situation, and time. I'm going to start my first part of my health assessment by starting at the head and working my way down. First thing I'm going to do is just note the hair. The hair does not appear to be dry. It is clean. And I'm going to palpate her scalp and just look for any kind of lumps.
It does feel good.
Okay, there are no lumps on her head. I'm also going to be noting her face for symmetry. And her face appears symmetrical. There's no facial drooping or anything of that nature. I'm also going to palpate her temporal artery and note that it is a 2+, that it's not bounding and it's not weak. I'm also going to palpate her temporomandibular joint. Have you open your jaw and close. And there's no clicking or popping that could possibly be associated with TMJ, which she does not have. I'm also going to palpate her sinuses on her head, and I'm looking for any kind of swelling or tenderness, which could indicate allergies or a sinus infection. And I'm also going to ask my patient, do you have any allergies or any sinus infections frequently?
Nope.
Okay. I'm going to be moving on to my patient's eyes. We'll just move on down the head. Courtney, do you wear any glasses or contacts?
No, ma'am.
Have you had any changes in vision?
Nope.
No blurred vision?
Nope.
Okay. We will start with the eyes, and we're going to start with a couple different tests on the eyes, and we'll start with the confrontation test. What I will do is have Courtney cover her eye. Go ahead and cover your left eye. And I'm also going to cover my right eye and stand in front of her. And what I'm going to do is I'm going to bring my hands over, and she will tell me when she can see that in her peripheral vision. And assuming mine is also normal, I will be looking for the same thing and see if we're at the same time here. So I'll just stand in front of her and cover up my eye also. And then Courtney, tell me when you can see my hand in your view. Look straight ahead at me. And then when can you see my hand?
Now.
Okay, and that was the same as mine, so you told me the same thing. Look straight ahead at me.
Now.
Okay, and then one more.
Now.
Okay. Courtney passed her confrontation test and was able to see in her peripheral vision about the same time that I was. I'm also going to check Courtney's 6 cardinal positions of gaze, and what I'm looking for is making sure that she's able to follow my finger and that there's not any nystagmus or any issues with that. So Courtney, I'm going to move my finger, and I just want you to keep eye contact with my finger, okay? Look up here. Okay, and Courtney was able to appropriately follow my finger. I'm also going to be inspecting her conjunctiva and her sclera and her cornea as well. So I'm going to pull her lid down here. Her conjunctiva is clear and I can see her blood vessels. Okay, and I'm also looking at her sclera and it's very white. There's no bloodshot that I'm noticing. There's no yellowness that could indicate jaundice. And I'm also looking at the irises and they are equal and round. And now I'm going to test Courtney for accommodation. And her pupil size is 2 millimeters. Let's do the accommodation test first, Courtney. I want you to pick a spot on the wall up there, and I'm going to put my finger and I'm going to move it in to your nose. And when I get there, when I tell you to look at my finger, I want you to look at my finger. Okay, you got your spot?
Mm-hmm.
Okay, and we'll look at my finger. Okay. And Courtney's eyes are reactive, her pupils constricted appropriately. Now I'm going to test her pupil response here with my light. Normally I would do this in a dark room or have her close her eyes for a period of time. But for the video's purpose, we will just do it this way. Okay, just look straight ahead for me. Even with the light on like this, her pupils are still reactive and equal. And then I'll do it again and looking at the other eye. Okay. Okay, Courtney's eyes are perla. They are equal, round, responsive to light and accommodation. For today's purpose, we will just explain the Snellen chart since we don't have one available. If I was testing Courtney's vision with the Snellen chart, I would place the chart on the wall. I would have measured out 20 feet and have Courtney stand 20 feet away from the chart. I would first have her cover up her eye, not with her fingers, to avoid any kind of maybe seeing through the fingers. I would give her an opaque card. She would stand in front of the Snellen chart 20 feet away. If she wore contacts or glasses, I would have her leave those on at that time. I would have her cover one eye at a time and have her start reading top to bottom on that chart from the largest letters to where the smallest line that she feels that she can read. What the chart would indicate, if you have 20/20 vision, or let's say 20/30 vision, it would indicate that you could read at 20 feet what the normal person can read at 30 feet. So we will move on to Courtney's ears. I'm going to inspect them on the outside visually. Courtney has normal sized ears. They are equal, they are symmetrical. I'm going to now look into Courtney's ears with the otoscope and look at her tympanic membrane or her eardrum. So in order to do this, I'll get on this side. For this ear, you're going to pull the pin back and down and then insert the otoscope into the ear canal. And you're assessing the tympanic membrane, and her tympanic membrane is a pearly gray color, so that's a normal finding. There's no discharge coming from her ears, no excessive amounts of wax. I would also ask my patient what her hygiene habits are as far as cleaning her ears. Courtney, how do you clean your ears?
I usually clean them after I shower with a Q-tip.
Okay, and this would be a good time.
Daily.
This would be a good time to instruct your patient on not inserting the Q-tip in too far and proper cleaning habits for the ear canal should they not have a regular routine. I'm also going to test Courtney's hearing test with the whisper test. With the whisper test, I am going to have Courtney press on her ear there, and I'm going to cover my mouth, and I'm going to whisper a set of mixed numbers and letters of 3, and I'm going to have her repeat those back to me. Okay, Courtney, can you repeat that back to me?
5AB.
Okay, and then I'll do the same thing on the other side.
JKL.
Okay, and that's correct. So Courtney has passed the whisper test. Her tympanic membrane looks good. Her ears are symmetrical, and there's no discharge. Courtney, do you have any history of ear infections, hearing loss,
Nope.
hearing change, no swimmer's ear? You don't wear any kind of hearing aids?
Nope.
Okay, so we will go ahead and move on to Courtney's nose and go ahead and examine that. I would be asking my patient if she has any discharge, any history of allergies, nosebleeds, anything of that nature.
Nothing abnormal, just a runny nose here and there, but it's like a clear discharge.
Okay. And if she had discharge, which she does, we would note the characteristics of the discharge. I'm going to test the patency of Courtney's nostril. So Courtney, I want you to hold pressure over one nostril and I want you to breathe in. Okay, and do the same thing on the other nostril for me. Okay, that's good. I'm also going to take a look at the inside of Courtney's nose with my septum for hygiene purposes, and because we do not have any disposable things that we're just going to pretend with this. I would consider this, and I would take a look in Courtney's nose, looking for any kind of discharge or polyps or lesions. I would inspect her turbinates to make sure there's no polyps on that. The mucosa in her nose is a little bit moist. You can kind of note a little bit of clear discharge in there. And next I'm going to move down to Courtney's mouth, and we'll take a look in there. Courtney, have you had any issues with dry mouth? Any sore throats?
Just some dry lips that I usually just apply a barrier to.
Okay, and does that work for you okay?
Yep.
Okay, have you had any issues with your tonsils? Have you had your tonsils removed?
No, I had my wisdom teeth taken out in 2010.
Okay, have you had any toothaches?
Nope.
Okay, so we would assess the patient as far as the subjective information that she gave me. I am going to take a look in her mouth with my light here. Courtney, say ah for me. Okay, Courtney has a grade 1 tonsils. Her uvula is midline. I don't see any swelling or lesions in her mouth. Her tongue is equal. It is not overly large. It's pink and moist. I'm going to take a look at your buccal or buccal mucosa. I'm going to put my gloves on for this. We'll use a tongue depressor to take a look at that. Okay, for this video's purpose, we're not going to wear gloves because they both ripped. Okay, Courtney, go ahead and open your mouth for me. Go ahead and stick out your tongue for me. Move it from side to side and up and down. Okay, she has full range of motion with her tongue, and go ahead and just lift your tongue up for me. Okay. Courtney's mouth is pink and moist. And then I'm also going to assess Courtney's gag reflex by just gently taking my tongue depressor and placing it inside of the outside of her throat. Okay, and Courtney does have a positive gag reflex. Okay, next I'll be moving down and assessing Courtney's neck. Courtney, have you had any kind of pain or swelling that or lumps that you've noticed in your neck lately? Okay, I'm going to test Courtney's range of motion with her neck. So Courtney, I want you to look up for me and then look down for me. Okay, look side to side. Okay, and then head to shoulder on your right side. Okay, head to shoulder on your left side. Okay, Courtney has full range of motion in her neck. I'm also going to be noting the symmetry of her neck, looking for any jugular vein distension or any kind of masses in her neck. I will also be palpating her lymph nodes to see if they might be swollen or tender.
Nope.
Okay. I will also be assessing her carotid pulse, doing one side at a time. and Courtney's carotid pulse is a 2+, it's not bounding. I am now going to assess Courtney's thyroid, and I'm going to come behind her to do this. Okay, by assessing Courtney's thyroid, I'm going to come behind her. I'm going to have her sit up straight for me, look slightly down, and tilt your head to the right side. I'm going to displace the trachea. Okay, and Courtney, go ahead and look to the left side. I'm going to do the same thing on this side. Go ahead and swallow for me. And Courtney's thyroid is not palpable easily, which is a normal finding for a normal adult female. I'm going to be moving down Courtney now, and we're going to take a look at her chest. Normally with auscultation with the stethoscope, you wouldn't want to have a gown or any kind of clothing on to avoid interruption in sound, but for today's video, we're going to leave Courtney's gown on. First thing I'm going to do is just inspect Courtney's chest, make sure it's symmetrical. There's no swelling, no bumps. Courtney, have you had any chest pain, shortness of breath?
Oh, ma'am.
How often do you get regular exercise or activity?
Oh, I would say 3 to 4 times a week for
Okay.
at least an hour.
Okay, and no shortness of breath associated with your cardio workouts?
No.
I'm also going to be noting her skin color, looking for any signs of cyanosis. Courtney, do you have any history of hypertension, coronary artery disease? Have you had any edema that you've noticed?
Nope.
No swelling in your legs, hands? Okay. I'm going to assess Courtney's radial pulses. Okay, and brachial pulses. And they are a 2+, and they are not bounding. We'll go ahead and check her capillary refill, and she has a less than 3-second capillary refill. I'm going to listen to Courtney's heart sounds, and what I'm listening for, I will be listening at the second intercostal space, right sternal border, and that is associated with our aortic valve. I'll be listening at the second intercostal space, left sternal border, and that's the pulmonic valve. And then I will be listening to the left sternal border, and that's the tricuspid valve. And then under the breast tissue in the left midclavicular line, I will be assessing her mitral valve and also counting. Here you are also supposed to count an apical pulse for a full minute, but for the purpose of this video, we will cut it to 30 seconds and times that by 2. With a stethoscope, there's normally a bell and a diaphragm. This is a self-tuning stethoscope, so to hear any kind of murmur or anything like that, you would apply a light amount of pressure. For today's purposes, we will be applying a little bit more pressure to hear normal heart sounds. Okay, and we'll count her pulse for 30 seconds. Okay, Courtney's pulse rate is at 66 beats per minute, which is normal for her. She exercises frequently, so it's normal for her to have a lower heart rate on the end of normal. Her heart is a grade 3. It's moderate, easy to hear, clear. There's no gallops or murmurs noted. It's not muffled or distant. It's easy to hear. Her pulse is regular. The rate, like I said, is 66. We will move. I will go ahead and assess her lungs on the back side before we do the front side. I would ask her, Courtney, do you have any history of a cough, bronchitis, pneumonia, tuberculosis, emphysema, COPD?
Nope.
No issues, like you said before, no issues with shortness of breath. Courtney, are you a smoker?
Nope.
Okay. Courtney, do you get tuberculosis tests, x-rays for your job?
I have to get a TB skin test for my job.
And that was negative?
Yes.
Okay. I'm going to notice I already noted on the front side, her chest is symmetrical, with a normal shape, her skin color again, looking for any kind of cyanosis. I'm going to come around the back side of her. I'm going to be checking for tactile phragmitis, making sure that I can feel vibration throughout her lung tissue. So we'll go ahead and start on the back side. Okay. Courtney, every time I place my hand, I want you to say 99 for me, okay?
Okay.
Go ahead.
99. 99. 99. 99. 99. 99.
Okay, I can feel the vibrations throughout Courtney's lung tissue, and that is normal. Now we're going to percuss in the landmarks that we also listen to. And we're looking, a normal finding would be resonance, which is a dull, moderate, clear. Okay, I'm going to also listen to Courtney on the back side. And your landmarks, you're going to be listening at the first intercostal space. The important thing about a lung assessment when auscultating is comparing your right side to your left side. So we'll go first intercostal space, second, third, fourth, fifth, all the way to ninth mid-axillary line. Go ahead. Every time I lay my stethoscope down, Courtney, I want you to take a good breath for me, okay? We're also going to be checking for bronchophony, egophony, and the whisper pecorally. Courtney, when I lay my stethoscope down, I want you to say 99, okay?
99. 99. 99. 99. 99. 99.
Okay, and that appears to be soft and muffled, which is a normal finding. Now, Courtney, every time I lay my stethoscope down, I want you to say E.
Okay. E. 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 E.
Okay, Courtney, now every time I lay my stethoscope down, I want you to whisper 1, 2, 3, okay?
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, and that is also very faint and muffled, which is a normal finding. So I'm going to come around the front side. And I'm going to listen to Courtney's lung sounds on the front side. And while listening, it is important to note that when you're listening, each time you place your stethoscope, you want to be listening for a full inspiration and expiration. It's also important to count your patient's respirations for a full minute. And you generally don't want to let them know that you're counting their respirations, as that can change the way that they are breathing. While listening to lung sounds, you want to make sure that you're not hearing any crackles, any rhonchi, any wheezes. If you do hear maybe some crackles or wheezes, you could have your patient cough, reassess, and see if that has cleared their lungs. First landmark I'm going to be auscultating will be the outer third of the clavicle, and then I will move down to the second intercostal space, third intercostal space, fourth intercostal space, and fifth intercostal space right under the breast tissue. Courtney, every time I lay my stethoscope down, I want you to take a breath in for me, okay? Okay, and this concludes our video for health assessment for the first half video. Thank you.